This lecture will go over pheochromocytoma. Pheochromocytoma is a catecholamine-producing tumor of the adrenal medulla. So when you hear or see the word catecholamine, what do you think of? Hopefully you're thinking of sympathetic nervous system, fight or flight. Pheochromocytoma tumors produce, store, and release epinephrine and norepinephrine. Excessive epinephrine and norepinephrine stimulates adrenergic receptors and can have a wide range of adverse effects mimicking the action of the sympathetic nervous system. Remember, the sympathetic nervous system is that fight or flight response. Although most pheochromocytomas are benign, they must be surgically removed to prevent life-threatening complications. In terms of assessment, the patient often has intermittent episodes of hypertension or attacks that range from a few minutes to several hours. During these episodes, the patient has severe headaches, palpitations, profuse diaphoresis, flushing, apprehension, or a sense of impending doom. Pain in the chest or abdomen with nausea and vomiting can also occur. Increased abdominal pressure, defecation, and vigorous abdominal palpitations can provoke a hypertensive crisis. Certain drugs and certain foods high in tyramine can also induce hypertension. The patient may also report heat intolerance, weight loss, and tremors. The most common diagnostic test is blood and 24-hour urine collection for fractionated metanephrine and catecholamine levels, all of which are elevated in the presence of pheochromocytoma. Surgery is the main treatment for pheochromocytoma. One or both adrenal glands are removed. After surgery, nursing interventions focus on promoting adequate tissue perfusion, nutritional needs, and comfort measures. Hypertension is the main sign of the disease and the most common complication after surgery. Monitor the BP regularly and place the cuff consistently on the same arm with the patient in lying and standing positions. Teach the patient not to smoke, drink caffeine-containing beverages, or change positions suddenly, which can stimulate blood pressure changes. Provide a diet rich in calories, vitamins, and minerals. Do not palpate the abdomen of a patient with pheochromocytoma, because this action could stimulate a sudden release of catecholamines and trigger severe hypertension. The patient is hydrated before surgery because decreased blood volume increases the risk for hypotension during and after surgery. The patient's blood pressure is stabilized with adrenergic blocking agents starting 7 to 10 days before surgery because of the increased risk for severe hypertension during surgery. Anesthetic agents and touching the tumor during surgery can cause a catecholamine release. Short-acting alpha-adrenergic blockers are given by IV bolus or continuous infusion for a hypertensive crisis. Post-op, monitor the patient for hypertension or hypotension and for hypovolemia. Hemorrhage and shock are possible, and plasma expanders or fluids may be needed. Monitor vital signs as well as fluid I's and O's. If opioids are given, check for their effect on blood pressure. When the tumor is inoperable, management is medical with alpha-adrenergic and beta-adrenergic blocking agents. For these patients, self-measurement of BP with home monitoring equipment is essential. Now we're going to do the end of the PowerPoint presentation questions. Go ahead and pause the video, read through the questions, and pick your answer, and then resume to hear if you got the answer correct. For the first case study question, the correct answer is B as in boy. For the second case study question, the correct answer is D as in dog. For the third case study question, there we go. For the third case study question, the correct answer is C. For the fourth, the correct answers are B, D, and E. For the fifth, the correct answer is C. For the sixth, the correct answers are A, B, C, D. For question 1, the correct answer is D. Question 2, the correct answer is C. And for question 3, the correct answer is D.